Hello, my name is Carly Seibel, and I'm a physical therapist and a neurologic resident at Creighton University in Omaha, Nebraska. I'm here today to discuss a physical therapy intervention called high-intensity gait training. High-intensity gait training is a treatment that prioritizes task-specific walking practice at high cardiovascular intensities in order to promote neuroplastic changes in those who have experienced a neurologic injury such as a stroke, an incomplete spinal cord injury, or a traumatic brain injury. Evidence has shown that high-intensity gait training helps to improve walking-related and balance-related outcomes in these populations that result in decreased assistance needed and increased discharge home. A clinical practice guideline was published by George Hornby et al. In January of 2020 that summarizes the multitude of evidence in support of high-intensity gait training for those with chronic stroke, incomplete spinal cord injury, and traumatic brain injury. This represents the current best evidence in the field for those whose primary goal is to improve walking function. The clinical practice guideline recommends intensities of either 60 to 80% of heart rate reserve or 70 to 85% of heart rate maximum in order to reap these benefits. Although this clinical practice guideline targets specifically a chronic population, there's also a multitude of evidence in support of this intervention with a subacute population. It's almost unfortunate that high-intensity gait training has been given the name because many hear high intensity and they think high risk. However, that's not the case. When appropriately monitored by a licensed physical therapist or physical therapist assistant, high-intensity gait training is found to be both a safe and effective intervention with a neurologic population. There are multiple different strategies that physical therapists can utilize to ensure that a patient is working at high enough cardiovascular intensities. Some of these strategies include adding resistance through either weights or bands, adding compliant surfaces or hurdles, going up and down stairs, increasing speed or distance, or changing the type of assistive device used. High-intensity gait training is not an experimental treatment. It represents the current best evidence within our profession for those who have experienced a neurologic injury and have the primary goal of improving their walking. There are now efforts by the Academy of Neurologic Physical Therapy to help translate this best evidence into practice. We as physical therapists need the support of the healthcare team and healthcare administrators to help increase the utilization of this evidence-based intervention. I hope that you'll take the time to talk to physical therapists in your clinic and educate yourself on the use of high-intensity gait training so that we as a team can help to improve the care that we deliver to our patients.